Hello and welcome to your COVID-19 vaccination center. Please keep watching for further information about your Pfizer vaccination today. Once you get inside, we'll check your booking if you have one, and we'll get your details up on our computer system. One of our team will double check that the vaccine we have here today is the right one for your age group. A trained healthcare professional will also be available to answer all the questions you might have about the vaccine. You move on to receive your vaccination from one of our trained vaccinators. We recommend giving the vaccine in your non-dominant arm, so that means if you're right-handed, that will be your left arm. It helps us if you already have your sleeve pushed up to receive the jab. After you've had your injection, you may be asked to wait for 15 minutes just to check everything is okay. An immediate negative reaction to the vaccine is extremely rare. We know you have lots of questions about the vaccine, and I would like to answer some of the more common ones right now. How much protection will I have after being vaccinated? The Pfizer vaccine gives about 90% protection against COVID-19 infection around 4 weeks after the first dose, and more than 95% protection after 2 weeks from your second dose. Evidence suggests that you will have protection from severe infection and hospitalization close to 100%. How long will it take for the vaccine to give me the best level of protection? It takes about 3 weeks after vaccination for immunity to develop, so it's important not to take any extra risks during this time. Do I need to have another injection after this one, and if so, when? Yes, it's vitally important you complete any course of medication to get the fullest possible benefits from it. The second injection boosts and extends your protection. In most cases, you'll be booked an appointment between 8 and 12 weeks from today, based on the scientific guidance of the Joint Committee on Vaccination and Immunization. This gives the best length of time for your body to get the fullest levels of protection from COVID-19. Should I continue to wear a face mask after being vaccinated? While vaccination does protect you and others, there's still a chance you can catch and spread the virus after you've been vaccinated. So you should still follow any government rules and guidance relating to social distancing, face coverings, or self-isolation after you've had both jabs. Can I still be vaccinated during pregnancy whilst breastfeeding and at childbearing age? The COVID-19 vaccines available in the UK are both safe and effective. The Joint Committee on Vaccination and Immunization advises that pregnant or breastfeeding women can be offered COVID-19 vaccines at the same time as other people of the same age. When asked if you are pregnant, it is important that you give the correct information, as this may affect which vaccine you are given. In the USA, at least 90,000 pregnant women have been vaccinated, and no safety concerns have been identified. There is no need to avoid pregnancy after vaccination, and there is no evidence COVID-19 vaccines have any effect on fertility or your chances of becoming pregnant. Can I still be vaccinated if I've had an allergic reaction from another vaccine, medication, or food? The healthcare professionals completing your assessment will ask you about any allergies and advise you on this. What are the common side effects after receiving this vaccine? You might find you get a sore arm in the hours and days after vaccination, and some people experience redness on the arms, swelling, itching, or warmth. Some people also experience other reactions, including a headache, tiredness, muscle aches, a raised temperature, or nausea. Lots of people don't experience any of these issues, and any side effects you do experience should pass quickly. We advise that paracetamol can be taken as needed, and that this won't stop the vaccine working. The vaccine contains no part of the virus and cannot give you COVID-19. What should I do if the symptoms last more than a week? If you experience side effects different from those I've just mentioned, or ones that go on for longer than a week, you can call 111 for medical advice. What if I have other questions? A healthcare professional is available to answer any questions you may have. Thank you for watching. You're only a few minutes from joining the millions who've added protection from COVID-19.